Dr. Byanjana Bashyal. Influence of tear and serum proteomic profile on disease severity in vernal keratoconjunctivitis.
Good morning, everyone. Thank you, AIOC, for giving me this opportunity to talk about our experience in the study we conducted, highlighting the influence of tear and serum proteomic profile on disease severity in VKC. I have no any financial interest. As we all know, VKC is a bilateral chronic inflammatory eye disease causing quite disturbance in the younger age group. It's more commonly found in male patients, and there have been many studies where they've evaluated proteomics and their role in cases of allergic eye disease. And also there are other studies which highlight the role of matrix metalloproteinases, IgE, serum vitamin D levels. So in this study we have evaluated the cytokines and matrix metalloproteinases and IgE levels. So this is a study which was prospective, non-randomized observational study. It was done after approval of Institutional Ethics Committee. We included 50 subjects, where 20 patients were included in severe group and 20 in moderate groups, and 10 were controls. The severity was based on the Bonini classification. The comparison was done of these groups. So in the study groups, what we've done was we've evaluated the cytokines, interleukins 2, 4, 6, 10, 17, tumor necrosis factor alpha, interferon gamma from tear and serum of these patients using flow cytometry, and serum tissue inhibitor of matrix metalloproteinases 1, 2 were done using ELISA. Total IgE and serum vitamin D were quantified, and tear allergen assay was done using Fadiatov test. So we've included more than 8 years of patients and less than 16 years of patients, and excluded the patients who were already on topical steroids or were steroid responder. And in our study, the overall level of cytokines were raised in tears of the patients in the group with active disease compared to the controls. But since the individual values were quite fluctuating, so it was not showing any statistical significance. Whereas we can see the IL-6 level, which is hiked up in tear as well as serum. We can see that they have quite significantly increased in tear as well as in serum. But in serum, it was statistically significant, whereas in tears, it was not. And interestingly, I wanted to highlight this interleukin 10 levels, which was seen in the study group, which was higher. And also the interleukin 10 was low, seen higher in control group. So this is a new study that we have evaluated, that it suggests the role of interleukin 10 being anti-inflammatory agent. So it was present in higher amount in the control group. And also serum interleukin 17A, which was present higher in study group. Here we can see this interleukin 17A, which was quite high in tears, as well as the serum. Serum was quite spiked up. So this was present in many of the study group patients. So coming to tissue inhibitor of matrix metalloproteinases, the overall values were comparable between, of the TIMP2 was comparable between the two groups of study and control. But tissue inhibitor 1 was present in lesser amount in the overall study group, but whereas it was present in higher amount in the severe VKC group compared to moderate VKC. Coming to keratoconus, where we evaluated using pentacam, in the severe VKC group, we've found that 50% patients were having keratoconus, whereas the 15% of moderate VKC were having keratoconus. But also in our study, there was one patient had keratoconus, and the severe VKC group had higher OSDI score compared to other moderate and control groups. And comparing serum vitamin D levels, it was lower in study and control groups. The normal range of serum vitamin D is more than 20. Overall, the values were lower in both the groups, didn't show any significance. And coming to these allergic factors, the mean tear allergen was higher in severe VKC group compared to moderate VKC group. So in our study, we've observed that the serum IL-10 was significantly raised in healthy controls than patients with active disease, as IL-10 is anti-inflammatory cytokine, which decreases the antigen-dependent cellular activation in allergy. Also, serum interleukin 17A was detected only in patients with active disease. Serum TNF alpha was present in cases with severe dry eye with OSDI score of more than 33. serum IgE was raised in study groups. 14% in the study group had keratoconus. The mean OSDI values were higher in higher clinical grades of the disease. Serum vitamin D were marginally better in controls but not significant, since this study was conducted during COVID times and after COVID, and because of less sunlight exposure it might lead to lesser vitamin D levels even in healthy controls. So in our study we conclude that we found the disease severity of VKC is significantly influenced by TRN serum cytokines, especially IL-10 and IL-17. Thank you.
Thank you. Madhukar?
Yeah. Is there anything new you found in the study? Because we expect all these parameters to increase anyway.
Because various studies have highlighted the role that highlighted that IL-10 is raised in cases with VKC. But in our study, it was opposite. We found that it was higher in controls than the patients with disease. So IL-10 is also an anti-inflammatory agent. So maybe that its presence in the control groups signify that it is in turn reducing the other influence of other cytokines as well.
One of the things in your conclusions, you gave some observations. In the observations, some of those things which were statistically significant you mentioned, but some of the others you did not. So it's better when you're giving the observations, this was statistically significant, this was not. For example, you mentioned keratoconus was higher in the vernal conjunctivitis group, but that was 14%. It was 10% in your control group, so it is not statistically significant. So you know, an observation which is not statistically significant carries much less weight than one which is statistical, because it's anecdotal, it could be explained away. So when you're giving your final conclusions, it's nice to classify only those which are statistically significant. Then you say these are the other observations that we had in this study. Yeah?
Yes.
Thank you.
Thank you.
Yeah.